Hi, my name is Anich. I'm an FSTJ nursing student. I'm in term 2 and section 5. Today I'm going to be hanging a Minibag for an IV. So I'm going to start by looking at my MAR. The doctor has ordered Fragile, which is an antibiotic via IV. The dose is 500 milligrams every 6 hours mixed into 100 milliliters of normal saline. So I'm going to look at my drug card first. The action of Fragile is bactericidal. The purpose is used to kill anaerobic bacteria from an infection. And I noticed that my patient has a urinary tract infection. So the recommended dose is 500 milligrams every 6 hours. The side effects include superinfection, dizziness, headache, and aseptic meningitis. The contraindications are hypersensitivity in the first trimester of pregnancy and severe and hepatic impairment. The nursing implications would be to obtain the specimens for culture and sensitivity before initiating the therapy, as well as to monitor the INOs and to assess the IV site for phlebitis, rash, or infiltration. So today I'm going to be doing 100 milliliters over an hour with 500 milligrams of Fragile mixed in. And I'm going to also, I want to make sure that the patient doesn't have any allergies and that check the labs. So I see on his labs that his white blood cell count is elevated. So I'm going to start by gathering all my materials and everything. I'm going to wash my hands, and we're going to go ahead, and I got my normal saline and my Fragile ready. I'm going to first draw up 6 milliliters of normal saline.
Yeah, we could probably lower this and put it on that table. Okay.
Okay, have my normal saline ready for the flush. I'm going to discard this needle in the sharps container. So this is all set. And now I'm going to draw up half a milliliter. Since my medication is 500 milligrams or 1,000 milligrams per milliliter, I'm going to draw up half a milliliter for 500 milligrams. I'm going to check the expiration date, and I see that it's not expired yet, so go ahead and pull up half a milliliter of air. Okay. And then I'm going to recap my needle. Okay, so now I have everything ready to go into the patient's room. Okay, so. Hi, Mr. Smith. My name is Chelsea. I'm going to be your nurse today. Your doctor ordered that we give you some Fragile to help fight off that urinary tract infection. So I'm just going to go ahead and can I check your armband and your name and date of birth? Okay. I'm going to check your IV site, make sure there's no phlebitis, no redness noticed, or any swelling, anything like that. It doesn't look like anything's wrong, so I'm going to go ahead and get started. First I'm going to prep my tubing. I'm going to mix my medication first. We'll do that first. Okay. So now that that's done, I'm going to go ahead and discard this in the sharps container. And I'm going to go ahead and stick my medication label on the bag. It's got the date, time, and my initials, as well as what medication is being given. I'm going to go ahead and connect the tubing to the bag. Okay. I'm going to go ahead and hang this up here so that's ready. And I I need to put my tubing label on as well. That's also going to have the date, time, and initials. Okay. I'm going to go ahead and prime my tubing. Make sure there's no air bubbles in here. Alright, so now all that's ready. I'm going to go ahead and wash my hands, put on my gloves. Alright, so I'm going to get an alcohol swab. We're going to start by flushing the IVs, make sure it's still patent, and clean off the site. I've got my saline flush. So I'm going to do the ASASH method. I'm going to aspirate back to make sure there's still a blood return, and I see blood. So I'm going to go ahead and use the push-pause method and administer some normal saline. And I'm going to do about 3 milliliters. Alright, sounds good. So now I'm going to go ahead and connect my medication. Alright, the medication is connected. So now I'm going to go ahead and unclamp my tubing and set the flow rate and everything, which will be 100 milliliters an hour. That way it uses over 60 minutes. Make sure that everything is flowing correctly. It's good. So now I'm going to make sure that the patient doesn't complain of any pain or anything while it infuses. And after that's done, I'm going to go ahead and throw away all my stuff. I'm going to remove my gloves and leave the room. And then I'm going to come back in an hour just to make sure it worked and disconnected and everything. So it's been an hour. I'm coming back. Hi, Mr. Smith. How did everything go? It's infused. The bag is completely gone. So I've got my normal saline and my alligator clamp ready again. So what I'm going to do is I'm going to clamp off the tubing. I'm going to go ahead and disconnect the tubing from the site and put the alligator clamp on, which I did not just drop that. Okay, I didn't drop it. And now I'm going to put that on my tubing. That way it's ready for the next administration of medication. Hang this up here. And one more time, I'm going to flush the saline. Flush with saline. Clean it off. And flush the last 3 milliliters. Okay. And so the last part of the ASASH method is to administer heparin, which we would only do if the doctor had ordered it for a PICC line or a central line. And so now I'm going to go ahead and remove my gloves. Check again for phlebitis or anything like that. I'm going to wash my hands, and then we're going to go ahead and document. So I would document what medication was administered, the time, drug, route, and dose, and also the condition of the IV site, which was good. I didn't notice any phlebitis or anything. I would also record the volume of fluid that I used to deliver the medication, which was 100 milliliters, and the INOs. And that's it.